This is the true story of a registered practical nurse in Ontario named Natasha Petit in a case heard by the Discipline Committee of the College of Nurses of Ontario on April 26, 2023. Natasha Petit, a nurse at Carasson Care Nursing and Retirement Home in Cobden, Ontario, faced serious allegations of professional misconduct. The hearing, conducted via video conference, delved into a series of incidents that occurred between 2020 and January 29, 2021. The allegations against Petit were multifaceted, involving apparently abusive behavior towards colleagues and inappropriate conduct with a patient. She admitted to using abusive language towards her colleagues, including calling one of them a while also accusing all of her colleagues as being lazy. Natasha also abused other staff at the facility, calling them names like and She also threatened a colleague with a physical confrontation outside the workplace, saying, "I will meet you out in the parking lot." The colleague who was threatened had to call her husband and ask him to walk her to her vehicle that evening out of fear that Natasha would be waiting for her after her shift. Natasha also admitted to physically assaulting a colleague by kicking them in the dining room, an act which was witnessed by other staff and patients. In another instance of physical aggression, she also slapped one of her other colleagues. In addition to her conduct towards colleagues, Petit's treatment of patients also came under scrutiny. On January 21, 2021, she threatened to withhold pain medication from a patient with dementia if he did not finish his supper. This incident, witnessed by multiple staff members and patients, was particularly concerning given the vulnerable state of the patient. Petit seemed to think that she was untouchable, repeatedly stating words to the effect of, "I'm the best nurse here," and "They came for my license, but I'm too damn good of a nurse." On more than one occasion, she disrespected a particular colleague in the presence of that colleague's 16-year-old daughter who was employed in the facility's laundry room. Natasha approached the teenager in the presence of several other staff and asked words to the effect of, "Is your mother crazy? Why is she always mumbling?" To which the teenager quietly responded, "No," and walked away. The teenager reported that Natasha asked her this question on multiple occasions, as well as the question, "Does your mother ever stop talking?" The case records go on to describe several other examples of abuse, but to be honest, I think you get the idea by now. So what was done about all of this? After all, the public has a right to know that the nurses and doctors that take care of us, especially the most vulnerable members of the population, are going to be treated in an ethical and professional manner. Firstly, Natasha was subjected to a formal reprimand. She was required to appear before the discipline panel within 3 months of the date when the order became final to receive this reprimand. This served as a public acknowledgement of her misconduct, emphasizing the importance of professional accountability. One of the most significant aspects of the penalty was the suspension of her certificate of registration for a duration of 10 months. This suspension became effective from the date when the order became final and continued without interruption as long as she remained in a practicing class, thereby preventing her from engaging in nursing activities during this period. Additionally, a series of terms, conditions, and limitations were placed on her nursing registration. These conditions were meticulously designed to facilitate her rehabilitation and ensure that she maintained high standards of professional conduct upon her eventual return to nursing practice. To begin with, she was required to attend a minimum of 2 meetings with a regulatory expert within 6 months from the date when the order became final. This expert possessed expertise in nursing regulation and was approved by the College of Nurses of Ontario. Petit had to provide the expert with copies of relevant documents and review specific CNO publications and associated reflective questionnaires, online learning modules, and decision tools. These sessions aimed to enhance her understanding of her behavior and its implications. Furthermore, Natasha Petit was mandated to successfully complete a professional and problem-based ethics course within 12 months of the order becoming final. She had to bear the expense of this course and provide proof of an unconditional pass to the CNO. Petit was also obligated to notify her employers of the disciplinary decision and provide them with copies of relevant documents for 24 months following her return to nursing practice. Employers were expected to confirm receipt of these documents and notify the CNO if Petit breached professional standards during this period, ensuring accountability and transparency. To support her continued growth and adherence to professional standards, Natasha Petit was required to engage in mentorship for at least 12 months after her return to nursing practice. These mentorship meetings, occurring at least twice monthly, focused on various aspects of her practice, including patient care, medication administration, adherence to public health and facility safety protocols, and interactions with colleagues. Lastly, she was restricted from practicing independently in the community for 24 months following her return to nursing practice. This penalty further emphasized the seriousness of her misconduct and the need for oversight during her reintegration into the profession. If you enjoyed this content, then don't forget to hit that like and follow button. I'm Ryan Keeney, and thanks for watching.